we're just waiting for people to come in. It's all loading up. All right, Carol, I'm going to give you control of the computer here for when you want to change the pictures. Okay, you got it there? Yeah, you're all set. Okay, so let me just do this for a second. I'm going to take it for a second, Carol. I just want to see up top how many people are coming on. It's still, the number is still ever increasing, so I thought we'd give it a wait till it levels off a little bit. All right, well, we're a couple of minutes in, so we'll get started, and the people who'll jump in, we'll just try and review. So, hi, everybody. Thank you very much for joining us today. I am Dr. Brian Broker from ENT and Allergy Specialists, and we're having this as the kickoff for what we plan to be an educational series that we plan on doing, and we're going to be having some frequent videos and webinars and town halls as we're going through this pandemic, talking about various topics, not just related to the pandemic, although we thought that was an appropriate one to start with, and talking about how you can maybe tell the difference between some common symptoms you might have versus if you have to worry if you have the coronavirus. At ENT and Allergy Specialists, we have already adapted to the new environment. We have a 24-hour-a-day telehealth presence, so we're able to care for people 24 hours a day. Colds, coughs, flu, allergies, and even the coronavirus, we can get people testing and get you to care if you need it. So if you have any questions during this, please don't hesitate to call us anytime. You can get us through our phone number, which will be at the end, and our website, which is our name.com, so ENTandAllergySpecialist.com. So tonight I want to introduce our speaker. We're very fortunate to have Carol Actor in our practice. Carol is a native of Phoenixville. She attended Brandeis University in Massachusetts, graduated from Temple University School of Medicine, and went on to complete both her pediatric residencies and her allergy and immunology fellowship at Children's National Medical Center in Washington, D.C. There she had the opportunity to work with Dr. Anthony Fauci at the National Institutes of Health during the early years of the AIDS epidemic. She practiced allergy and immunology in the D.C. area and was active in the Greater Washington Allergy Society for close to 20 years before she moved back here to home to be closer to family. And we've been lucky to have her here in the practice for the past 13 years. So without ado, Carol, go ahead and take the talk. Now, wait a minute, Carol. We don't hear you. Hang on a minute. Hang on, Carol. We're not hearing you. Let's go back and get your mic. So sorry, as I said, this is our introductory talk, and we may not have the mics all turned on. Let me make sure she has all this set. So hang on a minute. Oh, and by the way, I should mention while we're getting this set, if anybody has questions, if you go to the controls on your screen, Carol, let me take over for a second. I'm going to get your mics turned on. So if you go to controls on your screen, you'll be able to see areas that says Q&A, and you can type your questions into Q&A, and Dr. Actor and the rest of our group will be answering them at the end of the talk. So
Okay.
there you are. Now I hear you.
I've got my mic now. Great. Thank you.
All
Thank
right.
you, Dr. Broker. So as Dr. Broker said, this is the first of many ENT and allergy specialist town hall meetings. We've heard from many of you that asking about what the differences are in symptoms between COVID-19 and other common illnesses. So tonight's topic is cold, allergies, flu, or COVID-19. I hope you'll find the information useful. I'm looking forward to hearing your feedback. And as Dr. Broker said, I'll take questions at the end. Can you move to the next slide? There we go. Okay, the coronavirus pandemic that's going on now has many of us wrestling with fears and unknowns, so that every time we feel a tickle in our throat, our nose runs, or we cough, we start asking ourselves, do I have coronavirus? On the other hand, spring has sprung, and many people may at the same time be experiencing their annual tree pollen allergies. In addition, colds or upper respiratory infections remain common, just as was true before the pandemic. And although influenza or flu season is coming to an end, perhaps you've wondered if some of your symptoms could be the flu. Next slide, please.
Sure.
This chart helps us to see these symptoms to help us make a diagnosis. As you can see, a lot of the symptoms on the left-hand column are listed for several of the conditions on the top row. In fact, runny nose is seen in all 4 conditions, hence the confusion. Despite the similarities in many symptoms among these diagnoses, I think we can organize our thinking in a meaningful way to ease our anxiety and get us the appropriate care in a timely fashion. Let's go through the conditions one by one. I'm not being able to move the slides, Brian, so if you can move to the next one.
Okay.
Let's start with COVID-19. This is the one we're all worried about, and for good reason. COVID-19 is a novel community-acquired virus spread from person to person by respiratory droplets. It can be spread both through when people are asymptomatic and when people are symptomatic. It can be viable on surfaces for up to 3 days. And although most people have mild disease and recover at home, it can be fatal. We see this in the news. We see the worst outcomes all around the globe 24/7. The most common and sometimes severe symptoms of COVID-19 are fever, cough, and shortness of breath. The shortness of breath is very prominent and comes on very suddenly. It is not generally associated with wheezing, as we see in other things like asthma. Additional common symptoms are muscle aches, fatigue, loss of appetite. Less commonly, people may have diarrhea, nausea, or vomiting. Some people report a lack of taste or smell, which we don't usually see with the other conditions we're talking about. A significant number of people experience no symptoms. Keep in mind that most people with COVID will recover at home. A real distinguishing factor between the COVID-19 and flu is that flu symptoms usually occur simultaneously at the beginning of the illness. And COVID usually, symptoms occur slowly over the course of the first 5 days and may take up to 14 days to occur. Next slide. If you're concerned about symptoms, call us for a televisit and we can help arrange for testing and treatment as appropriate. The criteria for testing have been rapidly changing as more tests become available. The current tests that are being used are what's called PCR, polymerase chain reaction tests, and measure genetic material, the RNA of the virus. We are hopeful in the near future that we'll have what I would consider better tests that will measure antibodies to the virus that will indicate whether we've been exposed. Keep in mind that still the most important things that we can do is to prevent getting COVID-19 by continuing to practice social distancing, good hand washing, good hygiene, and the use of masks. Next slide. So how do these COVID symptoms differ from seasonal allergies? Let's say I have a running nose. Could it be COVID? Could it be allergies? Spring with warmer weather means allergy season for most of us. When you see trees in your area budding, you can bet the pollen counts will also be increasing. The most characteristic feature differentiating allergy from other respiratory illnesses is itching. People with allergies often have itchy eyes, itchy nose, sneezing, and less specific allergy symptoms, such as a runny, congested nose, sore throat, or a cough, usually from a postnasal drip. Another good predictor of whether your current symptoms are allergies is whether last year, the same time of year, you had allergies as well. Allergies are best diagnosed by skin testing in an allergist's office. If you're, as I said, if your current symptoms are similar to the ones you had in previous years, and those medications you used, such as over-the-counter antihistamines or steroid nasal sprays, helped you last year, it's a good idea to try them this year and see if they help you. As anybody with allergies will attest, allergies linger for weeks to months, as opposed to some of these other illnesses we're talking about. So the timeline of your symptoms is often a clue that this is allergies. If your medications are not helping, call us and we can help you discuss additional options for treating your allergies. Next slide. So we've gone through symptoms of COVID, symptoms of allergies. What about a cold? Isn't that associated with a runny nose? There's a saying in medicine, if you hear hoofbeats, think horses, not zebras, meaning common things are common, and a common cold still remains really common even during the pandemic. Obviously, symptoms of the common cold usually include a runny nose, a stuffy nose, as well as sore throat, headaches, and just generally feeling unwell. A mild cough due to a postnasal drip and sneezing can occur, but itching really isn't that likely. More severe symptoms such as fever, shortness of breath, again, not really classic with a common cold. Next slide. And obviously a cold is diagnosed without any particular tests, and cold medicines over the counter usually help with symptom control. Cold symptoms are usually gone in 5 to 7 days. So lastly, how do we distinguish the symptoms of flu from other conditions we've been talking about? In the United States, flu season is just about coming to an end, whereas unfortunately, COVID-19 numbers continue to rise. So true flu-like symptoms should really prompt some concern for COVID-19 at this time of year. Flu is characterized by fever, chills, muscle aches, exhaustion. It classically comes on suddenly, however, which may distinguish it from the COVID-19 symptoms, which often all the symptoms don't come on at once. In flu, more mild symptoms can also occur, similar to the common cold, such as runny nose, sore throat, and headache. Vomiting and diarrhea are uncommon in adults, but can happen in children. Flu is diagnosed by a swab test performed by a healthcare provider. Prescription medicines can limit the duration of the flu symptoms, but they need to be started promptly. The flu vaccine is an important part of prevention, and the duration of symptoms is usually a week, with symptom improvement around 5 days. Next slide. This chart, again, is from the American Academy of Asthma, Allergy, and Immunology with input from the CDC. As we spoke about, just to summarize, shortness of breath is unique to COVID-19, while itching and lack of fever point to seasonal allergies. Remember that flu season is just about over, and flu symptoms come on much more abruptly and together than COVID-19. Colds are mild and short-lived in general. Next slide. So thank you for your attention. I hope this has been helpful. There here are some more resources for information on the internet. This presentation will be posted on our website for future reference to come back to. Our next town hall meeting will discuss what we need to do to get back to work. And now we'll take questions from the audience.
So, okay, thanks a lot, Carol.
Sure.
So what I thought we'd do a little bit is talk a little bit first about, before we even get to some of the audience questions, just amongst the panel. Also in the talk today, we have the rest of the physicians in the practice. We have Dr. Laurence Cramer, Dr. Paul Swanson, and myself. We're all very active in our national societies. And one interesting thing about this COVID virus is that it's really brought the international community together. So I would tell you, we've had 2 or 3 international conferences a week since this has all started. In fact, we just had another one this morning. And so we're really hearing about the latest issues that have been happening around the world as far as infections, transmissions, and those kind of things. So I thought it might be valuable for us to just talk a little bit, you know, and tell a little bit to the audience of what we've heard internationally, and you know, why we think social distancing remains so important. So I'll start off a little bit, and you guys can jump in. You know, at one of our most recent conferences, they were talking about in other countries where they started to try to relax the social distancing. And you know, the problem with that is that we're artificially keeping the infections down by not being around each other. As soon as we start to be around each other, the virus is still there. And so then it starts to spread again. And so in several countries, including China, and even now parts of Italy, where they started to get it to calm down. Just this morning, some of the folks in Italy were telling us they're seeing an upsurgence again in certain parts of Italy because they relaxed some of the social distancing. So they're kind of snapping that back and going back to some of the social distancing again. So, so I'll open up to the rest of the panel. You guys have any other items of importance you think you've heard on some of the recent conferences you think it's worthwhile sharing with everybody?
Yeah, I had a bit to share. A personal experience I had was having the measles when I was in college. And so I had personal experience with the whole concept of contact tracing. And to me, something like a pandemic is a bit like a forest fire. You might put out a big forest fire, but you're always going to be worried that there could be little after fires, and you have to, you know, have surveillance over the area with, you know, planes, helicopters, drones. And if you have some additional fires, you got to put those out. And so when people say, when can life go back to a little bit more normal? We're not going to be really being truly normal until the whole vaccine is available or we have herd immunity. But a little more normal is trying to open stuff up, but the numbers have to be sufficiently low, and you have to have a super active surveillance system in place with tons of testing, which we don't really have. And you have to be ready to do all of that contact tracing. So again, with my case of the measles, I was thoroughly interrogated by the health departments where I was living in Connecticut and where I caught the measles in Rhode Island, and they interviewed everyone I had an association with. And so once we get the numbers low enough, theoretically, if there's a little outbreak, you can kind of track down everyone that person would have contact with and keep the outbreak a mini outbreak. And then if you do get to community spread, then you got to go back to social distancing again. So it's going to be a bit of a roller coaster.
Okay, thank you. All right, so then let's get on to some of the questions that we have here from the audience. We've had a couple people ask about asthma. So some folks have said, I have asthma, or if I have well-controlled asthma, am I increased risk for COVID-19? So anybody in the panel want to take that?
Yeah, I'll take that question. When the initial recommendations and observations came out from the experience in China, we were told that people with underlying respiratory conditions were at a higher risk for both getting sick with COVID and having a higher mortality from COVID. But the definition of underlying respiratory conditions wasn't very clear. And more recently, with the data from the United States, some of the parent bodies, like the American Academy of Asthma and Allergy, have looked at the data more closely and have come out with statements that say those with reasonably well-controlled asthma are actually not at any increased risk from catching COVID or for having any adverse events if they do get sick with COVID. So that's very reassuring to us that asthma is not, at least not a significant risk factor, additional risk factor for patients with asthma. So that's encouraging news.
Okay, that's great.
Mhm.
So another question we have, which I think is a good one, it says, do you have an opinion on what to use as a filter in a mask?
Well,
All right, so I'll take that one. Well, so basically what the most recommendations recently have been talking about is this. It's a question of what you're trying to accomplish with the mask. So that's the important thing to understand. And understand that the masks are different depending on the situation and the need. So we all talk about these N95 masks being in short supply. Those are masks that the healthcare workers need to wear when they're working around people who are actively sick, because they're actually coughing out a lot of virus. And the healthcare workers have to get right up into that air, which is full of a lot of active virus. And it's a much higher concentration with people who we know are already ill. And so you need those N95s to keep people who are wearing the mask from breathing it in. Now that's very different from what they're talking about, where the average public is going to be wearing a mask for social distancing. There, what they're trying to accomplish is something different. So they're not necessarily trying to keep you from breathing in the virus. Not that that's not a good idea. We would like to be able to keep everybody from breathing in the virus. The goal there, though, is for you to keep the social distance so you're not getting close enough to breathe in virus from people. So what the mask they're asking you to wear is, even if you're not close to people, is that when you talk or speak or even just have a little tickle cough, you're emitting all kinds of small droplets from your mouth. And they've done these studies as recently as just published yesterday from Harvard, where they showed how far the water droplets from your mouth can spread with a simple cough. And they spread as far as sometimes not just 6 feet, but up to 8, 10, 12 feet away. So the idea is, if you're wearing even just a simple cloth covering, so you could get a bandana and wrap it around your nose and your mouth, when you go out, you won't be coughing on the surfaces and leaving behind, if you're asymptomatic and have an early virus and don't know it yet, you won't be leaving those water droplets behind. And so you're going to prevent the spread to other people. Now, still, to prevent it from you, you still have to keep that distance from breathing in other people. And also, remember, somebody else may not be wearing a mask. So when you go to the market, you want to make sure that you're washing your hands frequently. If you want to wear gloves in the market, that's fine, but make sure you dispose of them and take them off cleanly from the inside out when you take them off your hands before you leave. And also take advantage of, most of the markets have some of those wipes on the way out for the cart, so you can wipe your hands or get some hand sanitizers for the way home. So always be careful that when you're touching things in a public space, you won't be picking things up where people won't covering their mouth. Okay, I hope that answers the question about the mask. Let's go on to the next question. So here I was exposed to someone who tested positive for COVID-19, but I'm not having any symptoms. Should I get tested? Who wants that one? Carol, what do you think?
So in general, we are still not recommending testing for someone who is exposed but does not have symptoms. I think that we will have a different answer for people when we have antibody testing. But currently, if you don't have symptoms, we don't recommend testing.
Okay. So here's an ancillary to that question. It says, if testing negative today, when do I need to be tested again? And I guess that a little bit depends on why you were tested in the first place. So I would say that if you were tested because you have symptoms, you really should be doing this in conjunction with your healthcare provider who ordered the test. If they thought there was a reason for you to get the test, then they're likely going to have you self-isolate for 2 weeks. And then if your symptoms do seem to be going away and you had the negative test, then after 72 hours of not having symptoms or a fever, then they'll feel you can get out of the isolation and you don't need testing again. If you continue to get testing, or God forbid you get worse, yeah, they may want to order testing again for you. The testing, the problem with the testing is, like any test, it's not 100%. And so although it's a genetic test, and they expect that if they pick something up and it's positive, that it's probably close to 100% correct, they don't have data on it yet because they rush these tests out for necessity. So the biggest problem though with these tests is sampling, which means that if you ever went for one of these tests, they have to rub the swab way in the back of your nose to the spot we call the nasopharynx. Not the most comfortable test. They also have to leave it there for 10 to 15 seconds. Again, not the most comfortable test. So anybody who's had this test will tell you they may not get the swab all the way to the right place. And so they might not get the most accurate test. And then there were a few cases where people's noses were testing negative, but eventually their sputum from their lungs, when they put a bronchoscope down and got some fluid out of their lungs, did test positive. And that's in people who were very sick and they had a high suspicion. So the biggest problem we have really is making sure you're getting a good sample, and that can still affect the validity of the test. All right, so let's go on a couple other questions we have here. Hang on a minute. So one question here says, don't coronaviruses cause the common cold? So why is COVID-19 different? Carol, what do you think about that?
So the virus that causes COVID-19 is in the same family. They're a coronavirus, but it is a different type of coronavirus. So it shares some of the proteins, but not all of the proteins. And so it came from the same family, but is a very different acting virus. And just like we've had diseases before in the early 2000s and the mid 2000s of SARS and MERS were also coronaviruses. They cause very different diseases than the common cold as well. So, you know, they share some genetic material, but not enough that, you know, these tests that we have can distinguish between them.
So here's kind of a related question to that. Somebody asked, could you have COVID that is being masked as a sinus infection or allergies?
I'll take that.
Okay.
So generally, if you have a sinus infection, you're going to have other symptoms like a yellow-green discharge from your nose. You're going to have pain in your face or above your teeth. You may have a little bit of a sore throat, which are more common for an acute bacterial type infection versus corona type infection. So it's kind of hard to mask it as that. And especially if you've had sinus infections in the past, it would feel the same as those other infections had in the past.
Okay. So now this is an interesting one. It's a good question. I like it. It says, we've heard about holding your breath for 10 seconds. And if you don't cough or can hold it without issue, then more than likely you don't have the virus. What do you think about this test?
So the CDC website says that this is a debunked myth. Although it would be nice if we had a quick and easy test like that for coronavirus, but it is not a foolproof way of ruling it out.
Okay. So we have another.
Careful of what, as usual, you have to be careful of what you read on the internet, especially with 19.
Right. Right. And let me say that as we're building the content on our website, we're going to have more and more links to what we think are some very good sites, put as much information on our site as we can, and so that you can find some very accurate information about this. So here another questioner asks, I feel healthy, but I have no idea if I've been exposed. I would love to donate blood. Do you know if blood is being tested to ensure that it's safe? So
I have to admit I'm not 100% sure of the answer, but I would have to assume that the filtering process that blood goes through after it is donated would pick up coronaviruses, because blood is extremely carefully screened after, donors are screened when they go to donate by questions. But then once you donate blood, that blood is goes through a process of filters and screening to filter out viruses. And although I have not looked into it, I'm sure many smart people have, and I would assume that it would. That's a great question.
Yeah. So another question I asked, and this actually didn't come through as a question, but I think I can guess what the question is, so we'll kind of extrapolate at the end here. This person says, I had a severe sore throat in March 15th to early April. A slight cough remains intermittently. The cough always seemed to be dry. I had a slight fever for just a short period, just once. No muscle aches, shortness of breath, but a runny nose and some other symptoms. That's it. So I'm assuming they're saying, do you think that I might have had the virus? So what do you think, Carol?
I'm sorry, what time period was this? When was it?
It started middle of March to early April. And he's wondering, I guess, do you think I had the virus with those symptoms?
It's possible.
Yeah. Yeah, it's possible. We just can't tell. What I'll tell you is that, you know, and again, this is where we're waiting on some testing. The antibody testing, which is different than the testing you're thinking about, the initial testing, the rubbing of the swabs in your nose or getting sputum from your lungs, is looking at the genes. The antibodies is a blood test to see if you've developed antibodies to this. Now, there's two problems with that. First, the tests are early, and again, we don't know how valid they are. In ideal situations, it takes years to make these tests. So it's very difficult for us to really say how accurate they're going to be, and they're going to get rushed out because people want them for all kinds of the obvious reasons to see if we can, you know, get out of the house and get back to some semblance of normal. But the second part of it is we just don't know if the antibodies are going to actually confer immunity to people yet, because there's kind of this lack of an explanation. Antibodies don't always make you immune to getting the virus. Let's talk about a couple of different vaccines for a minute. So you all remember getting the measles, mumps, rubella, the MMR shots when you're a kid. Those things will give you lifelong immunity because just the nature of the viruses and the vaccine. Whereas the flu vaccine, the immunity from the flu vaccine doesn't last much longer than a year. Plus, it can mutate. And that's why you're supposed to get a flu vaccine every single year. So, you know, will the antibodies to this virus give you lifelong immunity, give you a year immunity, give you just a month's immunity? We don't know yet. And so there's
I
some
think
really big
there's some early data on how much this is mutating and how rapidly, and it is mutating pretty slowly. So I think there is some cautious optimism that once the vaccine does develop, it'll give sort of more long-term immunity to people. And getting back to the issue, I'm actually scheduled to donate blood next week, as I think one of the people commenting just pointed out, that there is a need for blood donation because people are, you know, rightly trying to stay shelter in place, but people with various blood types, including O positive, which is mine, there's a big need for it. I'll ask them when I donate that whether they're testing, but I don't think there's been any like maternal-fetal. I don't think any pregnant women have given this to their babies. I don't think transmitting through blood is a big issue, but I can give an update to everybody next week. And please donate blood if you can.
Yeah, definitely. So another person's asking, is 6 feet absolutely or definitively enough social distancing, or should it be further?
I think with that question is the further the better, because we don't know. We're hearing so many conflicting stories. They're doing studies when people are running next to each other or riding bikes, and they show that if you're directly behind someone, even if you're riding a bike and you're 20 feet behind, you could still get part of their sputum or respiratory droplets. So I think that from the calls that we're making, we're talking to people and they're doing a good job of staying home. And I think if you can stay more than 6 feet away, stay more than 6 feet away.
Yeah, I would agree. So, all right, somebody also is asking if somebody had some PPE available to donate, where would be the best place to donate it? So
I think it would depend on what kind of PPE you have. So many of the local hospitals, I know Phoenixville Hospital has a person who will take the PPE. You can bring it to the front desk, to the reception desk. But if you have just masks in general, not N95 masks, but homemade cloth masks, the best place to donate those are nursing homes, local nursing homes. Most of them are in need of cloth masks for their residents.
That's good. It's good information. So another patient asks, what can we learn from the countries who are ahead of us on the coronavirus curve? So Paul, you were on that call this morning with the guys from Europe. What did they have to say this morning?
I was not on that portion of the call, but I did hear a talk from Zeke Emanuel, one of the leading people who study healthcare management and healthcare sciences at Penn, and he was talking about how Singapore is one country that tried to loosen up restrictions and had a couple of mini outbreaks, as you were alluding to, and in Italy and China. So all of these countries are, we're learning from everyone else. Certain countries like Germany, who have done a ton of testing and have really been aggressive, have really shown the value of testing. You can measure what % of the population gets tested, and the higher percentage of testing is done seems to have a much lower level of outbreak. So I think we can learn that more aggressive testing and contact tracing is our key steps, and when we're trying to get past the social distancing step.
Okay, so next question is, do we know why some people get severe symptoms and others don't, other than the underlying health issues? Like some people who, we hear stories about some people who are young, healthy people, but who still seem to get very sick or die from it. One thing I'll say, and I'd like to hear from the panel, it's a good question, and I think there's probably multiple answers. One thing I think it's important to talk about is exposure. And this is just certainly for healthcare workers, but it can happen to anybody in the community. It depends on the level of exposure. There's actually a dose to the exposure you can get. And there's chemicals in your body that are called cytokines. And these are just like little tiny hormones emitted by all the little white blood cells that tell the rest of the white blood cells to come fight the infection. And the more virus you're exposed to all in one dose, the more cytokines your body releases. And they find that in some of these patients, they get what they call a storm of the cytokines. And so just the inflammation is so sudden and so severe in some of these patients that it's the inflammation alone that kills them. Some of the therapies then have been addressed around that issue. So some of the therapies in the right patient are meant to simply calm down an overreaction of their immune system. And sometimes it works, sometimes it doesn't. And in some patients, they've managed to save them with some of these newer biologic medicines, they call them, which are kind of like chemical analogs to what's going on in your body already. They can artificially make these things now. And they kind of calm down the immune system. And in some of the patients, they can save them, but some of them, they still can't. So there's still a lot we don't know about that. But on that same question, because I think it's important to talk about, because, some people get complacent, I think, and they think, I'm young, I'm healthy, I don't have any other health problems, I don't need to worry about it. So I think this is kind of a corollary to what this question was, and I want to see what the panel has to say. What do people think about, do we know other reasons why people can get severe symptoms? And do we know other reasons why, even if you're young and healthy, why you still need to worry about this? So what does the panel think about that?
I think that's the biggest mystery going on now, because we're seeing such a diverse population of people getting sick. So I don't know if there's really an answer to that question that we can test scientifically right now. And that's what's kind of scary about this.
Right. And in some of our big cities where there have been surges, in Detroit and New York, there's been a racial disparity. And the question is whether that's because that population was getting less adequate medical care before they got sick, had more underlying health problems, had less access to health care, or there are some other factors there as well.
Okay.
So.
And that can lead into the idea of people with diabetes and hypertension, and whether you should stop taking any blood pressure medications, which may be ACE inhibitors.
Right.
And as far as I understand, the American Academy of Cardiology is suggesting not to stop your ACE inhibitors at this point.
Right.
Yeah. Yeah, and again, I know we talk about social distancing a lot, but I think it's worth emphasizing the point is that even if you don't have risk factors, those are the people who become the carriers if they get asymptomatic infections or mild infections, and when they'll pass it on to other people who can get very sick. And as we said, there are risk factors that we don't know. So you just don't know who's going to get very sick and who's going to die from this. And it's very important to take it very seriously. I am often surprised when I take my kids out for a walk outside that I will still see some people gathering in social groups. And it's very dangerous. And I know everybody's getting cabin fever already, and we got a long road ahead of us. But I think until we get some medicines, hopefully soon, to treat this, maybe that can loosen things a little bit. And until we get better immunity with a vaccine, this is just very dangerous. People are going to get very sick, and a lot of people are going to die. So it's so important to get the healthy people to take this very seriously, because the people who aren't very healthy tend to already take it seriously. They're pretty scared. So we have to make sure the people who are healthy are equally as concerned. All right, so another question is, does the heat and humidity affect the intensity of the virus? Are there more numbers in a human, the numbers in a more humid climate seem to be less. So what about the heat and humidity? What do you think about that?
I think early on, we were hopeful that this virus would act like some of the influenza viruses and have a cyclical seasonal pattern. It does not appear to be. We, as you can tell, our hot and humid states like Florida seem to be equally infected as our cold northern states. I think that theory doesn't really hold any water. We're seeing it in the Southern Hemisphere, just starting up now, so that I don't think that our optimism about that is not going to bear true.
Mm-hmm.
So.
Yeah, I would tell you there is some, some people were hoping that if you can make larger droplets, that the virus won't spread as far. Mm-hmm. And so there are some hospitals, like Temple Hospital, for example, has purposely turned the humidity in the hospital up to try and make larger water droplets, with just the hope that it doesn't spread as far. There's been a lot of thought that they differentiate between small droplets and microscopic droplets. The small droplets they call droplet precautions. The microscopic ones they call aerosolization, because they just float farther and literally hang in the air for hours, sometimes as much as 72 hours, depending on how small the droplets are. And so initially there was thought that it would only be in the larger water droplets that would settle quickly. And so you could clean a room quicker and the air would clear quicker if you just let the room sit for a few hours. But some recent studies show that it can hang around in the air for a long period of time. So there is some thought that, at least in buildings, if you raise the humidity, you may have less things passing in the air if somebody's ill. But that's not going to replace the social distancing. You still need to do the social distancing. Yeah. So we've had several questions, and I wonder, Carol, if you know about this. I wanted to ask. I'm going to kind of put these things together into a general question. Several patients have asked about certain vitamins or other things that you might be able to take that might protect you from a virus. One common question here seems to be about selenium. Do you know about any other vitamins or herbs or other supplements that people might be able to take that might protect them from a virus?
So, this is where research really comes in that there's a lot of anecdotal information going around, and there is some research about in viruses in general about things like zinc and vitamin C and viral particles attaching to throats and getting in, but nothing specifically for COVID. And so, you can read a lot of stuff online about it, but there really is no good data for that. Yeah. I think, sorry.
Go ahead.
No, I think like everything else, I think eating a healthy diet, lots of fruits and vegetables, trying to stay away from processed food and getting good regular sleep is what the best things you can do to keep your immune system healthy.
Staying hydrated too.
Yes.
So somebody asked a question that I know my kids are already asking about because they're looking forward to summer. Somebody was saying, can the virus survive in a swimming pool? And can we assume that chlorination will kill it?
I don't
So,
know the answer to that.
yeah.
But
Yeah, I haven't seen data about it yet, but I will tell you that, I mean, chlorine is essentially what we use on surfaces to kill the virus. So, so more than likely, the concentration in the swimming pool tends to be pretty high. So I haven't seen data on it yet, and we're looking for more studies for these kind of things, and I'm fairly confident the studies are going to be coming out as summer comes.
a
And
problem with a swimming pool, I mean, a public pool, it's one thing if you have an individual pool, a private pool, but a
Yeah.
public swimming pools, the kids are mostly above the water, but close to each other, you know,
Right.
et cetera. I know in
Right.
Florida, the public pools are closed right now.
Right,
Yeah.
right. And because it's not really, they're passing the virus outside of the water, not
Right,
inside the water, right?
right,
That's
yeah.
part of the problem. And
Yeah.
here's another question that nobody asked, but I imagine this too. A lot of people today don't have chlorinated swimming pool. A lot of people today have salt pools.
Right. Or
So what about
bromine.
that?
Mhm.
So that's interesting. I don't know the answer to that
I
because,
don't know
you know,
that.
water in the body is salt water. So it's a good question. I guess we have to see some studies to see if it would
Yeah.
survive. We don't know yet.
Mhm.
Okay. And so here's a question that I think is an important question, and I thought it might be a good one for us, to talk about as we're nearing the end of this. Somebody's asking, how long do we believe that it'll take to make a vaccine, and what's the process for making a vaccine? So, Carol, this is definitely your end, being an immunologist.
Well, I think 18 months is an optimistic answer. I think it could be done in 18 months, but it's hard to hurry vaccine making. It's something you don't want to get wrong. There's a certain natural time frame. It takes the body certain amount of time to generate antibodies, and you can't speed that along. So if you want to know if your vaccine is successful and you give it to a group of people, you can't tell those people to hurry up and make antibodies any faster than their immune system is going to do it naturally. And that's 6 to 8 weeks from the first dose. And some of these vaccines, this vaccine will invariably need 2 doses. Most vaccines, many vaccines do. So, one can imagine there are months and months of this, of studies that have to go on. It's just inherent in the way vaccine studies occur. It's hard to shorten a vaccine study, no matter how many people are working on it.
Yeah.
So.
And I have a little bit of inside information. I can tell you that we had a meeting this morning through a large physician group that I'm part of. And just speaking to some of the folks at NIH, they were talking about they're hoping to get started with a early vaccine trial, just a phase 2. They're looking at healthcare workers to start sometime in the fall. They're thinking that if everything goes well, and again, this goes back to what Dr. Atcher was saying, because it depends how everybody's bodies make antibodies and what kind of response we get. You know, the problem with the vaccine is that they have some experience making vaccines. It's not always the same. So what they do is they look at a virus, they pick out a part of the genetic code that looks like it's susceptible, that they can make a vaccine against it. They make a vaccine against it, and then they try it, and they have to see if it works. And there's a lot of trial and error in that, because if it doesn't, they got to move on to the next likely sequence of genetic code. And so they have to just keep trying and trying until they get the right result. And if they're lucky and they close their eyes and hit the bullseye in the dark with a dart on the first shot, then we get it quick. And so if that happens, they think they might be ready for public trials in a year. So, you know, with a lot of luck, and that's a lot of luck, we might be ready in a year for public trials of a vaccine. And that's why everybody says that 18 months is still optimistic for getting a vaccine. And so I think that's a really important process. One question here is kind of an administrative question, so I'll just answer it. It says, will you post links to the studies as they begin to come out so that patients can follow them from our website? And yeah, absolutely. That's what we're endeavoring to do. We want to make our website kind of a clearinghouse of information to the public so you can refer to it and find all the latest data. So we're going to be developing a page for that. And you'll see these videos, you'll see other videos, and you'll have links to with what we feel are reputable websites so you can get the most reputable data.
I was going to mention two things, Brian, on that note. There is an ongoing study now. If anyone in our practice has had COVID-19, and I hope if there is anyone that they've had a good recovery, there are two studies going on in downtown Philadelphia about collecting serum from those patients to help others in need, because one treatment that is very promising is hyperimmune serum. So giving plasma from patients who have recovered to those patients who are still trying to recover, hoping to give antibodies from one patient to another to help them recover. And so there are some institutions looking for patients who have you have to have had a positive test and recovered and be at least 2 weeks post-recovery. So if there is anyone, I'll put up a link to those two studies. There's also a study through the NIH that's recruiting patients, whether you've been sick or not been sick. They're trying to do a population survey of what is the denominator, because this is the big question is, since we think that most people are asymptomatic with COVID, or many of people are asymptomatic, we think that we're not reporting what the true numbers are in the country because we're only testing sick people. So they are running a study and asking for volunteers to give them a very small blood sample. They will mail you a kit where you can prick your finger and send a tiny drop of blood back to them on paper, a dried drop of blood on paper back to them. And they will then anonymously, without any of your name attached to it, run these samples and try to give us some numbers of how they want 10,000 anonymous donors, and they want to see how many people really are infected across the country. So I'll put the link up to that study as well.
Yeah, that's a great study,
Yeah.
Carol. I appreciate that, and I hope
Yeah.
everybody participates in that. I actually didn't know about that one. I think
Yeah.
I think I'll be calling to see if they get it for us too. I think it's
Yeah.
very important.
Yeah.
So, all right, I think, let's see if there's any other questions here. Oh, somebody was asking, I guess, will you get the results? Well, from that study, but I think it's going to be anonymous. So there's really no way to find out your own results from that NIH study, right, Carol?
Correct.
Yeah.
Yeah.
So, well, lastly, I think, and I know Carol talked before about, probably one of our next talks is going to be exactly what it's going to take for us to get back out to work again. But I do think we ought to give a little preview of that here. And I'd like to hear it straight from Dr. Acker. Carol, you lived through really the epicenter of a similar pandemic like this in the beginning, the AIDS pandemic, when you were training at NIH, when you were there and working with Dr. Fauci through similar amounts of uncertainty and fear that was going on. And so you really have a firsthand understanding of what it takes for us as a society to be able to say that our society is safe, that our blood supply is safe, that our hospitals are safe. So, I wonder if you can elaborate for everybody, just as we're, closing out here, what do we think it's going to take in general? What's the main goals for us to be safe? And I think it's important too, because we keep hearing a lot of this information differently from various politicians versus the physicians. And, what's your opinion about that? Where should we be getting our information from?
Yeah, those of us who are old enough to have perspective and wisdom, in the 80s, in the mid 80s, early 80s actually, when we first started seeing patients with HIV disease, we had no idea what was wrong with these extremely sick patients, and who had multiple parts of their bodies, multiple organ systems were failing. And it was a very frightening time. I was a medical student when it started happening, and then went on to residency. And people had no idea how it was contagious. People had all sorts of ideas that, in the end didn't pan out. But there was a lot of fear and prejudice surrounding the patients in the beginning because we didn't have knowledge. And I think that's the key, is that knowledge is what's really important, and getting good scientific facts that are based in evidence-based facts. So anyone can say this might work or that might work, but until we have studies that show what does work, we won't know. So I think it's very important to evaluate where you get your science from. I think the Centers for Disease Control and the National Institute of Health are both excellent places to get information from. Regular news channels, and your physician's offices, your primary care doctor's offices, your specialty care doctor's offices are great places to get information. But it can be a very anxiety-producing time, a very scary time, but we will see our way through this. There are always things to be gained when we go through a stressful time like this. And although we all feel bad for the people that it's affecting directly, we'll gain knowledge through this and insight and be able to help the people that come after them. So I'm optimistic.
So Dr. Cramer, Dr. Swanson, you guys have any perspective on that last question about, what we need to do, where we need to get information from, and what it's going to take for us to start getting back to a regular society?
Well, I think we should really look around the world and try and learn from what other people have already gone through. It's kind of hard because, unfortunately, we're not sure if we're being told the truth from some places in the world, and in other places we are. But hopefully our scientists and the leaders at the CDC will guide us through that. But we just have to be patient, unfortunately. It's pretty difficult to do that because we're all used to being active and doing our thing and going out and working and spending time with friends, and it's just a complete backwards lifestyle right now. But I think we're moving in the right direction.
Dr. Swanson, what do you think?
Yeah, my comment would, again, I think once we get through the surge of the acute terribleness of things and the numbers go down low enough, then we're going to be in a little bit of a state of limbo until vaccine is developed, and that's obviously a long ways off. So we're going to be kind of living in a world not as crazy as we are now, but it's going to be a world where we're going to have the contact tracing and the testing, and we're going to have to just deal with little mini outbreaks that will occur and try to keep them as mini outbreaks and get through it together. And everyone has shown how great the response has been with social distancing, keeping the numbers down. And we may be called back in to do that intermittently, depending on how things go. But like Dr. Actor just said a few minutes ago, we'll get through this together, and we've shown that we can do things as a country and as a community, and with good testing and good detective work with contact tracing, we'll get through it.
Mm-hmm.
Sure. Well, it's interesting. So somebody popped in a last question here I want to get to because I think it's important and it makes sense. And we'll close on this, and just a couple final thoughts that I have. Here it says, what are your thoughts about going to the doctor's office? For example, a pediatrician's office for my infant's regular checkup, or even just a plastic surgeon's office to get a biopsy of a sunspot. What are your thoughts about why don't you guys tell everybody what we're doing in our office, what we know other people are doing at their offices?
I would throw in one thing that I heard a recent thing. I think even Penn is trying to start doing some elective surgeries the first week of May on a trial basis. And they're going to test people before they do surgeries on them. And I think, in our offices, we're being super careful and monitoring everyone's temperature as they come in the door and asking, have you had fever or cough and all the symptoms? And so we're keeping our office as safe as we can. We are seeing a smattering of people who we have to see in person. The rest we're doing televisits. And then I think once we get better testing, then things like biopsies at your plastic surgeon and kind of outpatient surgical things can be done. And outpatient, we're seeing people on a limited basis, but once we get better testing, we can see people on a more extensive basis.
I think that to answer that question too, is that through telemedicine, I think we can get a better idea if you need to see someone more urgently. But if it's something that's related to a cancer or a more urgent issue, we need to talk to them and decide how we can help them.
So, and I'll tell you what we're doing in our office. So, you know, as everybody has mentioned, we're primarily seeing everybody through telemedicine. And there's a surprising amount that you can do in telemedicine that we just haven't been used to doing before, because there's always been this feeling that we really need to do a physical exam for patients. Ideally, we'd like to still, whenever we can, if we can get some things done just looking on a video, you'd be surprised. Sometimes we can get a pretty good exam of somebody's throat, or at least just, you know, talking to them, looking at the lymph nodes in their neck. But when we do need to get hands-on and really get a good exam, we will have the patients come to the office. We're very cautious about it. We take a really CDC standard type precautions, which means that patients only come in the office one at a time. Our office door remains locked at all times. People typically will, you know, if they come in, try and maybe wait in the car, and then they come in one at a time. We take their symptoms before they come in. If we think they have symptoms of the virus, we ask them not to come in, and we try and direct them to get the proper care elsewhere where they're set up for that type of problem. And we take their temperatures when they come in, and everybody wears a mask anyway. And then we do a tremendous amount of cleaning. And all of our exam rooms are set up now differently, so that when somebody comes in, every person is presumed to have the virus, whether they have it or not. And everything is clean and sterilized after that person leaves, as if they did have the virus. So, and that's pretty standard across the physician's offices now. So, you know, obviously it's worthwhile asking your physician's office before you go if they take that approach, but pretty much all of them are. And so if they are, then I think that you can have confidence to go there, that it's going to be safe. So we're at 9, we're a little after 9. So I think we need to stop here. I'm sorry if there's any questions we didn't get to. Please feel free to post them on our website. We're going to have a place to post them on the website. And we can answer them. If you have any individual questions about yourself, as I say, we're available, all of us, for televisits. If you feel like you're sick, we're available to talk to you after hours as well, at any time of the day or night. We're happy to speak to you anytime. And you can get us, as you see here on the screen, our name is our website, so you can just get us there, and at any other time. So thank you, Dr. Actors, thank you, Dr. Cramer, thank you, Dr. Swanson, and thank you to our audience for coming today. We appreciate being able to care for everybody, and all of our patients that have come in. We hope that we give you the care that you need, and that you feel that we're doing a good job. If you can too, please, on our website, on our blog, or you know, please post any ideas or any questions you have about future topics, anything you want to hear, because we're going to be making as many topics as we can for these talks in the future, and have videos for you to refer to. So thanks, everybody.
Thank you.
And stay
Night.
safe.
Good night.
Good night.
Good night. Thank you.